Guys, I'm China B, and this is The Markup. Thank you, Dr. Nasser, for joining me on the Markup podcast. Today we're here with Dr. Nasser. He is one of my favorite plastic and reconstructive surgeons, and we're talking today, and one of the reasons I wanted to have you on, and you were on our previous podcast, the Unfilter It. So I wanted to take a deeper dive because Dr. Nasser has such a great social media presence on TikTok. And what I think is so cool about your presence is that it's very authentic and it's like you. It's just you, and that's what you see on TV, and that's what you see in real life. So thank you for coming.
Well, thank you for having me. I'm excited, and I'm just going to be as authentic as I am on social media.
I love this so much. So I just want to dive in so people get to know you. What drew you into plastic and reconstructive surgery? Because we know it wasn't the BBLs that everyone thinks that, you go into plastic surgery for that.
No, it definitely was not the BBL. So I grew up in a family of two physicians. My father is a plastic surgeon, and my mother is a pediatrician. And so I grew up kind of soaking in,
Medicine.
in medicine. And one of my earliest memories is walking through hospital hallways with my parents, either on their day off, like going in to see a patient, or even on regular days if they were going in, and I was after school or whatever. And then I was just always curious by it. But it also became very normal place for me. So by the time I was like 14, 15, hospitals were not a scary place for me at all. It was just kind of like second home. And at the same time, one of my earliest memories is my father was helping a patient who had a pretty tragic factory accident where he was working on a metal stamping machine, and the big, I guess, stamper part came down on his arm and amputated his arm, and he had to come in for an emergent replant. And my father wanted to videotape part of the operation, and he called me in to do that. And I went in. It was just one of the most fascinating things I've ever seen, all aspects of the surgery. And then I got to see that patient then heal and actually regain almost, I would say, 80 and 90% of the functions of his hand. So that was a very transformative, early experience that if I was to pinpoint one thing.
So that's what made you catch the bug, as they say.
Yes.
Wow, that's really something that I think a lot of people can relate to, is because, I think that people out there are like, oh, I go into medicine because I want to help people, but you at a young age, actually saw that in action.
Yep.
What were some of the early moments in your med school that shaped your philosophy of medicine for today?
Yeah, many. I mean, we had different rotations, obviously, for the different specialties in medicine. And I just went in with a very open mind, honestly, to a lot of the rotations. So I went into every rotation just saying, oh, maybe I'm going to like this. I went into internal medicine. I knew I wanted to do something procedural, but going into GI, I was pretty interested. I loved working with kids. So even when I went into my pediatrics rotations and primary care, I loved it. I mean, I got some really great letters from my mentors because they could see I kind of thrived on the interaction with people. I loved kind of spending time, even in the office hours. And then really, I think rotating out of Leahy Clinic. I was in Tufts Medical School, so we rotated out of Leahy Clinic in northern Massachusetts. And that was very transformative because they had a very advanced, very busy surgical service. And they had a transplant team that had just relocated to Leahy, a big transplant team, 6 surgeons doing both liver, kidney transplants. And I got to rotate with them, and it was amazing. Yeah. It was absolutely amazing. We got to, as medical students, first, second assist on a lot of the cases, but one very memorable experience was being up for like more than 24 to 36 hours, having done a regular day, and then we went and we had there was an organ donor, a person who was recently deceased, dying, and was generous enough to donate organs, and we were going there to get said organs for somebody who was a candidate who obviously gets called. And so we went to do that, and we came back, and I got to actually be part of the transplant surgery itself. And I remember coming out at like the 36-hour to 40-hour mark being kind of like delirious, but at the same time being so happy and so fulfilled about what we just did.
Right.
And it was like that moment, I'm like, if I'm this tired and I'm this happy, that's a sign.
Right.
Yeah. That's, I think, what I want to do.
That's
of course,
awesome.
I didn't go into transplant, but a surgical field.
Yeah. Well, that's amazing. So, I mean, I want to like kind of just segue into your TikTok doc with a punchline now, because, I think what's unique about you is you keep your integrity. You're very authentic to like who you are in real life to what you see on social media. And I think a lot of people don't necessarily have that. They have like an online persona, and then you meet them in person and it's like a little bit different. So can you explain a little bit about how you built such a following without losing your integrity?
That's a great question. I think I started right during residency, just kind of almost chronicling, that's the word, right? Things that I was just doing on a daily basis in my rotations. If I did an interesting case, if I learned something new, or if we were celebrating a certain occasion or meeting. So it just came very organic, like from the get-go. I've never been fascinated by the glam of plastic surgery.
Right.
And I'm sure this is going to piss some people off or upset people, but I mean it in the nicest way possible. I guess growing up and seeing my dad do both reconstructive and cosmetic, but he worked in a university hospital and he helped a lot of people. And he wasn't living the 90210 lifestyle. So that wasn't my idea of you only know what you're exposed to.
Right.
So that wasn't my idea of plastic surgery. So from the get-go, that wasn't in my DNA. And I just kind of went with that. And if anything, actually, I find the online persona very off-putting.
Yeah.
And I think that's one of the things that I intentionally am trying to bring a little bit more like realism into what we do. The highest compliment that I would get from anyone that sees our Instagram or TikTok is they come in, they're like, oh, I feel like I met you already and you're the same person. I'm like, yeah, that's exactly it. One of my youngest patients who we operated on, she knows who she is. I'm not obviously going to give any details, but she said, yeah, you're quirky. And I just took that as such a great compliment. I'm like, yeah. I think we have a little bit of that. We have our own unique style. I love my team. Shout out Jen and Sue, and obviously all the team that we work with. But I love my team. Coming to work every day is a treat, and we just keep it real.
Yeah,
you guys
vibe really well.
Yeah, absolutely.
Okay, so the balance between, and in our industry, because like you said, and even in purely aesthetics, what I do, it's like you can sometimes get disheartened. Like sometimes I'll go to conferences that aren't, plastic surgery conferences, they're just aesthetic conferences, and it's that glam. It's like who's most popular on Instagram. They literally give awards for that, which I'm sure I will also piss people off about that. Like there's like, upcoming
I'll
person.
vote for you.
Yeah. And it's like I prefer to like speak to the science of like what's happening and like helping people achieve like confidence and doing that sort of thing. So since I mentioned the topic of conferences, can you speak to the balance between education for people on social media and entertainment? Like clearly we want to keep it fun and interesting, but also people informed.
Yeah, so I'll answer that question in a different way, I think, which we'll touch on that. I think one thing that I came up against was how do I, as a majority reconstructive, part cosmetic surgeon, portray myself on social media, especially social media emphasizes more of the cosmetic side of plastic surgery
Right.
because for better for worse, that's what gets views.
Yeah.
What I actually found was quite the opposite. I found that, for example, I'm very passionate about occipital neuralgia. My video that went the most viral, if you want to call it that, was a video talking about occipital neuralgia. And so that is definitely not a sexy disease. It's not a, you know, oh, you're going to get famous doing occipital neuralgia, but it touched so many people. It hit a nerve, no pun intended. Sorry. See, that's why they say quirky. There you go.
We love that.
So it definitely it connected with people.
Yeah.
And the number of comments that I got from it. So it told me that, hey, as a reconstructive surgeon, solving very real problems and helping people, you can still connect with people online.
Yeah.
Because people are looking for answers,
Right.
no matter where they are, and you can connect with them quickly and easily. So that's one part of your answer. I think the other part, which emphasizes education, is, well, there's the giving back aspect of it, is like, now we know, now it's our duty to give back and teach both. Like, part of my main motivation of doing social media, it's not just the patients, but it's also like the juniors coming up in our field, the residents that want to go into plastic surgery, the junior attendings, the year 1 attending, year 2 attending that are just starting.
Right.
So I think there's a big role for that. And then I think the third part to answer your question is some of the most prolific cosmetic plastic surgeons that have had their name after cosmetic procedures started out as as amazing reconstructive surgeons.
Yeah.
If you know the anatomy and you know how to fix the anatomy, that actually makes you a much better cosmetic surgeon.
For sure.
So they're completely intertwined.
Yeah.
Like, I'm not one of those people who like poo-poos. I think cosmetic surgery is fascinating, but I think it has to be done safely and appropriately. And I think we have to remove some of that, you know, the extra spice.
Yeah. The gaudy.
Yeah,
if you will.
yeah.
So let's talk about your passion for occipital neuralgia for the people that may not know what that is. And admittedly, when I started with our group here, I came from the cosmetic realm, and we didn't do a lot of reconstructive, and most of the reconstructive that we did was breast. So learning a whole lot about all the different things that you guys do, it was one of the things that interested me particularly, because I treat so many people with headaches, and that there's actually a surgery that may help. So I'll let you take the floor with that.
Well, the way I got involved with occipital neuralgia was completely by coincidence. So we had Dr. Jay Austin, who is the chief of plastic surgery at Massachusetts General Hospital. He was a visiting professor, and he was giving us a lecture in my residency. And I was sitting in the back, and much like any other kind of half-tired resident, I was talking to the chief resident next to me, and I was like, oh man, this topic is boring. You know, it's just like, you know, and then I went up, and he has a very magnetic personality that kind of like whatever he's talking about, you're going to get interested. So slowly we got like talking, and then eventually he talked to me about the fellowship that he has, which is part breast reconstruction, part migraine surgery.
Oh, wow.
I got very interested in that. It was a great opportunity. I ended up doing it. One of the best things I did in all of my training. And I just got to see a way to help highly functional individuals. We're talking CEOs of companies who have a very solvable problem, which is occipital neuralgia, get reduced to nothing and be on disability because of debilitating headaches.
Yeah.
And it's very easy to dismiss those people as like chronic pain and, oh, they're just like, there's other issues or psychiatric this or that, or, you know, like to just dismiss them, you know, as unfortunately happens with chronic pain patients. But I really got to see a way to really help these people. And part of our training is we train extensively on nerve reconstruction and nerve surgery. And here is a problem that you can easily solve with a surgery to decompress those nerves that run in the back of your head. And without going into the full details, but it's basically like carpal tunnel of the head.
Right.
You have a compression of a known nerve, and once you decompress it in the right patient, they can be cured, or at least their headaches can be markedly improved.
Which I think is so important because, like, even in emergency room visits, like a large percentage of complaints for emergency room are headaches.
Yep.
And there's not a whole lot that we would do as providers in the emergency room setting for those patients other than give them maybe a steroid, some pain medication, and then send them on their way and say, see a neurologist.
Yep.
But a neurologist not only is also like kind of tied to the treatment plan sometimes, which it's like, let's trial this medication, let's do this therapies. So it's so nice to know that there's a fix.
100%. I think there's a statistic that says, up to 3% of all ER visits are related to headaches. That's a huge number.
Yeah.
And then there's other studies that show that, like in a peripheral setting, like a hospital setting, tertiary setting, I should say, a quarter of all headache visits had an element of occipital neuralgia.
Oh, wow.
So you're saying a quarter of that 3%, but you're talking about millions of visits a year. So it's not an insignificant number.
Right.
And I think, like you said, you hit a very important point, which is just understanding or knowing what the hell is occipital neuralgia. A lot of people don't know that. And I'm saying, actual physicians, even plastic surgeons, not all plastic surgeons. We get taught about it like as a line during our training, and that's it.
Right.
I was just fortunate enough to have that amount of exposure in the training, but a lot of people may see it or hear about it once in their life or not at all.
Yeah.
There's some studies that say there's a delay of up to 19 years.
Wow. 19
years to diagnose someone with occipital neuralgia. That's amazing.
Yeah, that's profound. Especially since headaches and chronic pain patients, higher incidence of suicide. And
Absolutely.
like you said, they're usually high functioning people.
Yes.
Interesting.
Yes. There is a high incidence of comorbidity with depression, anxiety, other psychiatric illnesses with occipital neuralgia that has been studied.
So now if you have headaches and you are interested in maybe seeing if you qualify for occipital neuralgia treatment, now I'll link all the information to our office and you can come in and see Dr. Nasser for that. Okay, so some viral moments, going back to the TikTok incidences, viral moments. So what are some of the things that you have seen that maybe has shocked you, and some things that changed? We talked about life-changing things from some of the surgeries that you do, but some of the stuff that you see that may have shocked you in plastic surgery.
Good shock or bad shock?
Let's go with bad shock, because I feel like everyone wants to know the take.
I think a couple of things. So I think fillers and Botox are obviously very, very popular for obvious reasons on social media. And I think when done appropriately and safely, you're an expert in this, if they're done safely and appropriately, they're amazing. If not done safely or appropriately, I think you can have disasters on your hands. So I think that's something that, is very, very viral, but I think you need to go to the correct provider and people who are trained.
On that note, I will say what has shocked me is that, as a plastic surgeon, when you're posting your before and afters, and even as an aesthetic provider, when I'm posting before and afters, the truth is we're really showcasing what we think is our best work, right? We're picking out.
Yeah, that is very true.
Yeah, we're picking out who we want to showcase as our stuff.
Yep.
And so some of the stuff that I see that's before and afters of shocking, very pointy chins, very overfilled cheeks, and I'm thinking to myself, oh my goodness, that is what someone's best idea of what they do is.
Which you actually hit on a very, very important point, is that we also have a role to talk to our patients as to what, for lack of a better term, is reasonable and what's not.
Right, realistic.
And if it's realistic, reasonable, and if it's something that doesn't kind of align with what we think is harmonious with the rest of their phase or whichever area you're working on, then we should tell them. And you'd be surprised. I think 9 out of 10 people would be like, "Oh, okay."
Yeah.
But I think some providers probably just like intimidated by saying no, that's not good for you.
Right.
Or they're motivated by
the
the
dollar.
gain. Right.
Mhm.
Unfortunately. So I think that's one thing. I think the other thing, obviously, is you mentioned BBLs. I think that's I hate to call it a phase. It's not a phase, but I think there's a very good and useful role for fat transfer and augmentation in the buttock area when it's done safely and appropriately and with the right aesthetic. I think doing it unsafely, in these days, you really need to be doing it with ultrasound or doing high volume like BBLs and all of that. I think that's dangerous. And I think that's something that unfortunately went viral online, and we haven't seen the end of it yet.
So I think the joke in our industry about BBLs in particular is that, you're doing such surgery that's very high level and skilled, and people sometimes don't understand the complexity of the BBL surgery because there's a lot of things that can go wrong.
Yep.
There are large vessels in there that you can't just be shoving, fat grafting rods. Hey guys, just popping in. It's me, China B, your favorite nurse practitioner, and I'm just here to remind you to subscribe and like so that you stay up to date on all the newest episodes from the Markup. Where do you see aesthetics and surgery headed next?
I think first and foremost, safe surgery and safe procedures.
Yeah.
And I think the awareness of that has increased tremendously, and it's a good thing. Because we also don't want to attract negative or bad attention to what we do, and we genuinely want good results for patients. And so, when we take the Hippocratic Oath and, it's first do no harm.
Right.
So even though it's amazing to do nice cosmetic procedures and surgeries, by that I mean both the injectables and the other procedures and surgery, it has to be safe first and foremost. And I think that has been a welcome increase in awareness over the last couple of years. And then I just have a big pet peeve with trends. Yeah. I just hate trends. I don't know. They call me old school or whatever. But I just think trends are such a ridiculous idea. And this whole concept of this year, that's what's in Vogue or fashion. I don't mean Vogue, the magazine. But, you got to do what's right for you. It's not what's in fashion. It's what fits you. It's what makes you whole. It's what, So I just hate trends.
Yeah.
I hate that word.
I think most of us in the scientific community anyway also feel the same. In my realm right now in purely aesthetics is that there's lots of controversy over platelet-derived growth factors.
PRP.
Yeah, well, now they're just using human-derived growth factors that are grown in the lab, and there's FDA approval and wound care for healing wounds and stuff, but people are experimenting and putting it in the face without a lot of whole research and science behind it. And I know that innovators are going to try things, but when you're innovating something and you're trying something out, you're doing your own experiments on people that you trust, or you're not making it mainstream and teaching the masses on how to do these things. And unfortunately, with not there being a lot of regulations for what I do, if you're not working in a plastics office, if you're in a med spa, you put this in the wrong hands and we got major problems.
I think that's applicable to a lot of things. One other thing just to to bring also is the whole idea of advanced 3D imaging and 3D analysis of for example, facial aesthetics. And I think from the cosmetic point of view, systems like the Vectra system and others that have been around for a long time were pretty successful in kind of simulating what things would be. Obviously, nothing beats before and after pictures,
Mm-hmm.
but you can at least tell a patient what they may look like. And I think applying the same thing for facial aesthetics, I think is the next kind of level of that.
Yeah,
Yeah.
for sure. Communication in healthcare.
Oh, I love that topic. I love that topic. I always say that most issues that are in any team or in any system, 9 times out of 10, it's a communication issue. Whether it's a breakdown in the communication, whether it's delivering the message in the wrong way, using the wrong mode, in the wrong timing. I think if you solve communication in most teams, you will have amazingly functional teams. And it's something that's always a work in progress in my own team, but we have a very open communication. We have, a secure text message group between, HIPAA compliant between the four of us, that we all know what the other person knows at any given point. And that just makes things so much easier. I think that improper communication is a disaster.
Yes. And you have a lot of emotional intelligence and self-awareness because of your practices that you do in mindfulness. What advice do you have for up-and-coming surgeons who are going to be leaders of their own teams for success in, not only just the operating room, but in your daily practice?
Well, first of all, thank you. I think it's something that I work on a lot. It's something that I credit my parents first and foremost. It has to do with upbringing. It has to do with an awareness that you're not, that the world doesn't exist to serve you. Okay, I think that's and that's something that I even teach my own kids. We're here to serve others. We're here. Part of the normal development of a child is to go from this phase of a me-centric world, like a 2 or 3-year-old, that the world revolves around you, and that's intentional or beneficial for their stage of development. But you're supposed to grow out of that. Now, the problem is I see this move towards a very me-centric world right now, and unfortunately, I think with social media, that has not helped.
Yeah.
Because it's all about what am I doing? Which vacation am I going to? Which cool spot am I in? FOMO. And then you see a lot of this rise of psychiatric, because people are just seeing this unrealistic picture. So upbringing, I think, is extremely important, but also just understanding where you are. One of, I think it was Simon Sinek, who was a great motivational speaker I listened to a lot, said that once you understand that in a team, even as a leader, you work for the team, not the other way around. Mm-hmm. Once you understand that, just kind of understanding who your team members are, being close to them, and understanding who they are as people. What are their strengths? What are their weaknesses? And once you get all of that, you will it'll become harmonious, and then you don't really have to work at it. Then it just works.
Yeah.
So I think that's a big deal. I mean, these are human beings. They have families. They have things outside that are going on. So that's something that I try to work on all the time. And I think that, and it's something I know that, we may hit on later, but I think as a surgeon, you run the risk of having a big ego. Mm-hmm. And I think this is probably one of the most important things that my dad taught me, is that ego is the killer of all good surgeons. I think nothing more true has been said, is that you can go into, as any kind of surgeon, into any surgery thinking this is the simplest surgery in the world and you're God's gift to, medicine. And you go in and the surgery will humble you. Yeah. And you will quickly find out that anything can happen. We're operating on human beings. You're not I always tell patients, if you cut a piece of wood in a certain way and get another piece of wood cut in the same way, usually you get the same result. You can operate on two patients, do the exact same operation, and have a completely different result. We're operating on human beings. We're operating on, a live tissue. So I think, humility and like really checking that ego, keeping the ego out the door, I think is a huge thing. And I'm human just like anybody else. I've had moments where I'm like just happy to have done something, and then I get in the moment, but I'm very quickly reminded.
Yeah, and I think that's such great advice. Surgery, for me, working in surgery and being first assist and doing all that stuff, I've always found that surgery is so humbling, and it really showcases how fragile we actually are as humans. You have a body that's on the table that's being like medicated and sedated in a way that, every single checkbox has to be marked. Your heart rate, your blood pressure, are you bleeding appropriately? Are you not? Are we in control?
It's a lot.
It's so much to think about, and I do think that, especially, I don't know if it's a generational thing, but us both having teenagers, it's like hard to raise them in a society that's me-centric currently. So I think that's profound advice for you younger surgeons to know. Keep your egos in check.
Yeah, check that ego.
What do you think that some patients should be asking when they meet a surgeon and aren't?
Yeah. So I think choosing a surgeon involves you finding someone who specializes in the issue that you need, of course. That they're board certified, definitely, very important. That they understand you and you understand them, and that there is actually a kind of chemistry, for lack of a better term, between you and the surgeon, that you understand each other and what the issue is at hand. If you don't see eye to eye with your surgeon and vice versa, it's not a good thing.
Right.
Not to state the obvious, but especially for elective procedures, where if you're not doing like life-saving surgery, obviously if you're doing life-saving surgery, you do what you got to do, and you just get it done. But if you're picking a surgeon for a highly specialized procedure, it is important that you see eye to eye with the surgeon. I think that's very important.
And might I add, like having a little trust and not relying on ChatGPT, Google.
Yep, I think reviews are great to look at, but meet the person.
Yeah.
Do you get along with them? Like I said, there has to be a kind of like common understanding.
Yeah. All right. So going into what we spoke about a little bit earlier, and how you were raised, and your mindset practices, and keeping ego out of the operating room and more on the like table of the sacrificial, rituals, as you will. Let's talk about kindness for a little bit and how that influences your day to day.
Yeah. I think it was Robin Williams that said that, everybody you see on the street is fighting a battle that you don't know of or don't know about. And it is so true. I think all of us have been through, the good and the bad, have been through like challenges. And think about yourself at one of your like hardest moments or one of your lowest moments, when you were still going to work, still interacting with other people, but the people around you don't know what you're going through, but also anything can kind of like break you at that point.
All right, so we're on cut or keep.
All right.
Surgeon influencers dancing mid-surgery.
Cut, absolutely.
Yeah,
cut. 100% cut. Disrespectful, dangerous, just off-putting.
Yeah, I feel like you need to be focusing on surgery.
Yeah.
And it's almost like, I want to say the OR is a sacred place.
It is a sacred place. There's a lot, there is, you're entrusted with a person's life, with their healing. Listen, we listen to music while we operate, but we don't, just yeah.
But you have to be like
Not
you're
dancing.
respectful of the patient and like
Yeah.
definitely a sacred place. We don't want to.
Yes.
We used to say like you don't want to upset the surgery gods.
Agreed. Agreed. Definitely cut.
Breast implants over 800 cc's.
Cut.
Unless
For reconstruction, we're absolutely necessary, and even then, put a couple of asterisks, because it's just a lot of weight. It's a lot of implant, a lot of weight. It ends up stretching the tissue. So if you're ever going to do that, you're really going to have to put in like some kind of internal bra support, be it a mesh of some sort or alloderm or something. So only for reconstruction, only for specific.
we're so
reasons.
aligned.
There you go.
I love it.
It's the crystals.
It's the crystals. All right, closing vibes. What do you want patients to feel after leaving your chair?
I want them to feel that they met someone who understands what they're going through, and that they have at least the preliminary confidence that we can help them, and that we're going to do our best to help them. I'll tell you what I tell a lot of my occipital neurology patients is I can't promise cure, but I can promise that I'm going to do my very best.
I love that.
And I think if you're very realistic with patients, much like we were talking about the fillers and doing things that you don't think look right, but you're doing them anyways, we have the power to have an honest conversation with our patients, and I would say 99.9% of patients actually appreciate that, and they're not annoyed by it or upset by it. They actually want. I mean, I've had patients come in where they explain something to me, and I truly, genuinely have no idea what the issue is, and I tell them, well, I don't know what's going on. We'll try to find out. And in some cases, we may not find out. I may have to refer them to somewhere else or someone else, but they're still grateful because I'm just as honest as I can, with them. And I think, during medical school, there was this giant painting in like the first floor, like when you got into like before the lecture halls. And there was a saying there, and I'm just paraphrasing, is that you need to be comfortable saying, I don't know. I think medical mistakes happen, or mistakes in general happen, if you're not comfortable saying, I don't know. You can say, I don't know, but I will find out.
Yeah.
It's okay to say that. We're learning our entire life, continuous
it's full
learning.
of practice.
Exactly. That's exactly right. So, that's what I want them to feel going away, and to know that their doctor's quirky. No.
We love that. We love a quirky surgeon. What message do you have to future surgeons?
Be humble, be kind, and be grateful to the both talent that you have and the responsibility that you're given by your patients and by the community. So, those three things.
I love that. Well, thank you so much for
Thank
joining
you.
me on the Markup on our homegrown little platform here. I really am so grateful for your time, your knowledge.
I'm grateful to you. I had a blast.
Yeah, your humbleness, your lack of ego. We love it so much. Tell the listeners where they could find your social media and see your quirkiness in action.
There you go. So on both Instagram and TikTok at Nasser Plastic Surgery.
Awesome, and I will link them below. Again, thank you so much.
Thank you.
Yes, until next
Thanks,
time
Jenna.
on The Markup with China B.